as you saw, the northern area is a community that's mostly affected by overdose and hospitalizations because of substance use. So we would like to have that support. Thank you. Any questions?
Any questions from council?
Yeah, so thank you. I know it's my second time. And you know, for context, you know, this council unanimously approved a letter a few months back requesting for Board of Supervisors to declare illicit fentanyl a public health crisis. A letter that I did author, much like the resolution that brings many of you here today. And the reasons were the accidental deaths caused by fentanyl is the #1 killer between the ages of 18 and 45. As Undersheriff said, more than 60%, nearly 2/3 of the nation's fentanyl seizures occur in San Diego Imperial County, port of entries. Rural law enforcement agencies from sheriffs to PD have historically had difficulties with funding, with recruitment and retention. As you said, the North End has the highest rate of overdose deaths in the county, and locally in 2021, a 15-year-old did die due to fentanyl.
Yes.
And so although it wasn't formally declared a crisis by our board, it was acknowledged. That did get us to the conversation we're at today. And I started reading, where did we get here? How did we get here, right? It's just, it didn't happen overnight. And so I went back looking at old articles. Sorry, no Desert Review. Sorry, I went back farther than that. 1962, Detective Sergeant Joe Sutton, in charge of the Brawley area, ran for sheriff because of the threat of youth drug addiction, and that between 1954 and 1961, there was a 400% increase in the number of juvenile arrests for using or possessing dangerous drugs. 1970, local Dr. Thomas Hindle, along with several teenage addicts, made a plea before the Imperial County Board of Supervisors on the need for treatment facility and rehabilitation services. In 1977, in the annual local methadone report, here's what stated. There have been indications through our years of experience with the heroin addiction and problem in this county that Eastside Brawley must indeed be the heroin capital of the world. Not only was there a large number of Mexican-American hardcore addicts, but a large number of white or Caucasian hardcore addicts as well, coming from the other side of the tracks. In 1986, police estimate that there were about 1,000 addicts living in Brawley. That's despite the population being only about 15,000 at the time. Finally, in 1995, in a local news report, when discussing a treatment clinic, Brawley was referred to as the Valley's historic hotspot for heroin. And so Brawley doesn't have a drug problem. We've had one. Here we are, 50, 60 years. I know it's not a winning campaign, it's not a platform, it's an issue much bigger than us. It is an ugly topic, but it's a real one. I think we've all been indirectly or impacted by not fentanyl, but by addiction. And like you said, the war on drugs, you can't punish your way out of this. If you look back since the war on drugs, as you said, drugs are more affordable, they're cheaper than ever before, more accessible. I'm sure no one could have an issue buying them. And as we've seen with overdose locally, as with recently, stronger. So something has to be done and something different. I think it's going to take the entire community, we shouldn't put this on the backs of behavioral health, the cities as well, community organizations. They really need to come together because this is an issue, like you said, that's shown. It's not going anywhere, and we can't ignore it, and it impacts the entire city. And so I really appreciate you guys coming and sharing about this. Hopefully we can support your efforts. I know you bring up treatment facility, and automatically everyone's going to think methadone clinic, but that's not necessarily what you're calling for when you call for a treatment facility, correct? It's simply the services. Mm-hmm. I'm sorry. Yeah, right.
No, it is an outpatient clinic that we run in Imperial County Behavioral Health Services. And with that, we have contracts with residential facilities. Currently, there are no residential facilities in Imperial County. Therefore, we contract with residential facilities in Riverside and LA County at this time.
Yeah, and I understand. I received treatment in residential treatment as well some time ago. There is a stigma. And I get that, and it's breaking those, right? It's breaking those. People do need help. I was fortunate enough to afford it. My parents were able to fork out the money that they constantly remind me of. Yeah. But there's so many that don't, and I put myself in those shoes of someone who is socioeconomic disadvantaged, who grew up in poverty, who grew up in a broken household, who may not have both parents, who have these barriers in place, and sometimes the only help is through behavioral health. And like you said, punishment, you lock someone up, there's drugs there, you bring them back out, there's drugs out here. And so it's much deeper. When it comes to addiction, it's much deeper. And yeah, I'm really, like I said, really grateful that this conversation is going. Hopefully we can keep it forward. But thank you.